If you're sluggish and your skin's starting to get very dry, and perhaps even your hair is getting brittle or you're losing your hair, and if you've noticed even that the outside of your eyebrows are losing their hair too on both sides, you might be subjected to the beginnings of or the overt symptoms of hypo or low thyroid disease, what we call hypothyroidism. Some people actually have a goiter, an enlarged thyroid in their neck, and there's others that complain of very non-specific symptoms, including even loss of sexual desire. If you're seeing any of these, you might consider talking to your doctor about the fact that the thyroid may not be functioning properly. Women seem to be more susceptible to this problem, but men, we're not excluded. It just seems to be more prevalent in the females than in us. The way to test it is a couple things. Getting 3 tests for sure, one called a TSH, one called a free T3, and one called a free T4. Now, these blood tests aren't perfect, and there is a very large distance between what is optimal and what is normal in the labs. And try to get a doctor that's integrative in his or her approach, that recognizes that these lab tests, although they might be normal, may not be optimal, and you still may require either iodine supplementation or perhaps even thyroid supplementation. Having a thyroid low for a long period of time isn't healthy and can cause damage to everything from your heart down the line, and actually, in essence, cause a shortening of your lifespan in general. Got to be healthy. Let's take a look at these things. Check your temperature every morning before you wake up underneath the armpit. And if it's below 97 degrees, at least most of the time on checking it for 10 days, you could pretty much rest assured that your metabolism is low and it may be a thyroid issue. Or take some red iodine after a shower and paint a silver dollar size on your neck. And if you don't want it conspicuous, then put it in a non-conspicuous place and see if it disappears over a few hours. If it does, you may also have an iodine deficiency, something absolutely necessary for the healthy functioning of the thyroid. Let's keep ourselves healthy. www.drmitchshow.com. I'm Dr. Mitch.